Hello, and thank you for joining us at the Wyoming Cancer Program's listening session. My name is Tanya Reekins, and I am the outreach nurse for the program. This session's topic is Cancer Treatment Referrals to Medicaid for the treatment of breast and cervical cancer. For the past 26 years, the CDC and the National Breast and Cervical Cancer Early Detection Program has provided high-quality breast and cervical cancer screening to women who do not have health insurance or who have inadequate insurance. As the healthcare landscape changes and continues to change, the CDC continues to look for new identifiable needs and opportunities to increase cancer screening and to further explore and expand new roles for the Wyoming Cancer Program well into the future. The WBCCEDP is the only nationally organized breast and cervical cancer screening program in the United States, one that has successfully weathered the test of time by effectively serving diverse population of women through public health and primary care delivery systems established across the entire country through the states, territories, and tribes. Through the WBCCEDP, the CDC helps those with low incomes who do not have adequate insurance and help with access to timely breast and cervical cancer screening, diagnostic, and treatment services. The WBCCEDP also provides patient navigation services to help them overcome barriers and get timely access to quality care. Patient navigation has been an integral part of approaches used by WBCCEDP and has been adopted by the Wyoming Cancer Program to assist women in receiving timely and high-quality breast and cervical cancer screening, as well as follow-up services. There is a listening session in the month of April that covers this topic really well and breaks the patient navigation through the program down for you. Treatment is provided to women who are eligible and who qualify for early treatment so that treatment can begin early. They do need to have a diagnosis of precancer condition or cancer at any stage involving the cervix or breast. Coverage will be provided throughout the course of their treatment. All women needing a referral to Medicaid for treatment will need to have a current application with the Wyoming Cancer Program. If you need further explanation on the application process, there is also a listening session for this in the month of May that covers the application process in detail. We also need a current pathology report confirming the diagnosis of precancer cells or that cancer is present in the breast or cervix. There are circumstances where a client who is on Medicaid in another state and they are looking to transition over to Wyoming, they will be eligible to apply for Wyoming Medicaid as well. They'll just need to submit the original pathology results along with the provider's note stating that they are currently on treatment. Those clients do fall under the Medicaid's criteria for eligibility. We can't stress enough the importance to notify the Wyoming Cancer Program of the women that are diagnosed with precancer cells and cancer and the need for treatment. Our goal here at the Wyoming Cancer Program is to avoid any gaps between the screening program and the diagnosis of cancer in these women. If approved for Wyoming Medicaid, they will go back 3 months from the date that Wyoming Cancer Program submits the referral. So again, we just want to ensure that we avoid any gaps in coverage. All women diagnosed with a cancer diagnosis of breast or cervical will be given a referral to Live Health, and we'll discuss that in more detail in another slide. Wyoming Breast and Cervical Cancer Treatment Program is a special eligibility group within Medicaid that provides medical coverage for women who are diagnosed with breast or cervical cancer and need treatment. There is eligibility requirements that they do need to meet with the Wyoming Medicaid. They must have a current application with the breast and cervical program. They do have to be a U.S. citizen or have immigration status. They do have to be a Wyoming resident. So if they're moving to Wyoming, they would need to have an existing Wyoming address. They also cannot have any insurance coverages that includes Medicare. All women do fall under the eligibility income guidelines. If they were to apply directly to Medicaid without this Treatment Act, the income ratio level is 138% below poverty level, whereas the Wyoming Cancer Program's eligibility guidelines is 250%. So it does make it a lot higher for those women who do work but still have a financial barrier and a need for treatment. You can access those income guidelines from the link included on this page, and please jot it down. And then in there you can find the provider's manual as well as the poverty level guidelines, which is updated yearly. Medicaid will receive the referral from the Wyoming Cancer Program and will determine eligibility. Medicaid's customer service will make 2 attempts to contact the client. This usually happens within 48 to 72 hours once the referral is made by us. Once contact is made, they will help them fill the application out over the phone, or they can have the application mailed out to them. Process goes a little bit quicker when it's done by the phone call that they make to the client. Benefits begin the first day of the month when the individual is determined eligible. Applicants are eligible for retro pay benefits. They will need to notify Medicaid that there was treatment done between the screening program and applying for Medicaid. The Department of Health Customer Service notifies the client of any pending approvals, denials, and closures by sending a notice, usually within 2 weeks of the application, unless other circumstances arise. All referrals to Medicaid are good for up to 6 months once the Wyoming Cancer Program makes those referrals. So if for any reason the patient does not respond back to Medicaid, they will archive it after the 6 months. If it's after the 6 months, Medicaid will require that the Wyoming Cancer Program send over another referral. Benefits begin the first day of the month with an individual when they're determined eligible. Applicants, again, are eligible for that retro pay if they incur any bills during the gap. Clients who are diagnosed with breast or cervical cancer will be given a referral to Live Health. If they're denied for Medicaid, Live Health will help navigate them through other resources that may be available to help with financials, such as 211, foundations in their area, or other resources, or get them scheduled with a social worker in their area. The clients will remain in the Wyoming Cancer Program. However, it is for screening only. The program does not cover any treatment services. So again, they will need to apply for the Wyoming Cancer Program via the application is online. Providers can print it off the most current online application, and then so they can fax it over to us. Immediate notification of a diagnosis of cancer is so important to the program. So please let us know if you have any questions. There's our main line, and your call will be directed appropriately. If you have any questions or concerns, please fax all pathology results to the 777-3765, and customer service, Medicaid's customer service number is right there for you. We'll go ahead and open it up to any questions or comments. All right, well, I want to thank you for joining our listening session, and feel free to give us a call or contact us with any questions or concerns. Thank you.